started for Livingston HealthCare in 2007, and as a registered dietitian, it's really important to me that we serve our patients and our staff and our guests the most healthful food options. And when I started there, it was all pre-processed, ready-prepared meals, served in aluminum foil, and for me as a dietitian, that I knew that we could do better. We began by cooking from scratch, which takes a little bit more labor. So we were able to hire 4 more full-time cooks. Cooking from scratch, we started purchasing our food, whole foods. And so being in Montana, in a big agricultural state, we were able to source a lot of those whole foods right there within our community or within the state. And so not only were we able to create new jobs, but we were also giving back to the community economically by purchasing food within our community. And then the healthfulness of our food really increased. So certainly chronic disease is an issue, and we offer several education sessions for employees and for the community members, diabetes prevention programs and diabetes education and empowerment programs. But we really needed to model the advice we were giving those participants. So with the change in our menus, we could really lead by example and show them, yes, these are the types of foods we're recommending you eat, and not only that, we're serving you those foods as well. And so it was very helpful in demonstrating the types of foods they should be eating, not only in these classes, but for the inpatients as well. So really modeling the types of foods that they should be eating and that we're recommending as dietitians. We've always been open to the public, but previously our old facility, the cafe was in the basement of the hospital. There were no windows. It was very, the ambiance was poor. And then we built this new state-of-the-art facility with a beautiful dining room, atrium area. And I was able to have a lot of say in the design of that space. So we put all the food on display. Again, we use a lot of color in our cooking, a lot of fruits and vegetables, a lot of herbs, so people can see the food. They can interact with the chefs. There's a large window looking into the kitchen, and there's also a prep area right on the service line. There's a lot of interaction with the customer and the chef. They can talk about where the food came from, how they're preparing it, what techniques they're using. They give samples out, and so that really drew the public in. So not only do people come and get their physical therapy appointment and then come for lunch, or see their physician and then come for breakfast, but they come in and have business meetings there. They come just for lunch. It's a beautiful ambiance. We have walking paths behind the facility. It's right along the Yellowstone River. So getting the public in and having them dine has been huge. And it's really increased our revenue, which is obviously very helpful and makes our CFO happy. And it allows us to hire really highly trained culinary chefs, which just perpetuates, the good food that we are creating. One of my favorite things to see, so we're a fairly large ranching community, and we purchase proteins from ranchers in the area. And I really like the sense of community, because you may have a rancher who's visiting his wife in the hospital, and he's dining in the cafeteria, and it may be his beef that we're serving. And sitting right next to him or at the same table is his physician or his wife's physician. So it really does foster this great sense of community where we can be very proud that we are giving back to those families that live in our community. And not only that, the food is so good. The physicians, the nurses, the lab techs, everybody eats there. And so living in a small community, Café Fresh has really become this destination where you could be sitting next to your physician, you could be sitting next to the CEO, and you could be eating the beef that your family is producing. So it's really kind of a neat model.